Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Well, thank you for listening to American Medicine Today. I'm Kimberly Brumell, joined by my jovial crew.
Yes, we are today.
Our radio executive producer, Ethan Euchre.
How you doing today?
Very good.
Right.
And also our friend. And then to the side of me, to my right, I have our friend and senior fellow, Jeff Wagstaff.
Presented by Dr. Bonati. How are you doing?
We're doing well.
And then across from me, that man over there is world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for joining us.
Hi.
He's fired up today.
Man of few words, but yes,
we're
very
high-fiving
energetic.
over here. We're ready to go.
And I'm struggling because I went through a major fitness training yesterday, something called 4U Fitness, and the most intense workout, 20 minutes.
I was there. It was pretty funny.
Yeah.
Watching you struggle.
The sweat pouring off you, but
That's a story for another
whole
day.
That's
other
because
story.
she's a couch potato.
Oh,
What do you expect? She barely lifted glass to drink water.
wow.
Right. Well, it's enough. It's enough trying to reel you in. But, people listen to us week after week. And why they need to listen to that man over there, world-renowned orthopedic surgeon, Dr. Alfred Bonati, is because he changed medicine. He changed spine surgery forever. There was invasive spine procedures, and then through him and his contribution to medicine, he realized that traditional spine surgery was bad and that it reflected poor results. That bothered him, so he actually broke away from those textbook teachings, and he developed and created his own tools and methods called the Bonati spine procedures. And those are the ones that are on the market. Don't let them be confused with just typical, minimally invasive spine surgery, because they're not the same. They are worlds apart. His actually targets the true root of the patient's problems and brings true patient resolve. With that said, we have a very full show. We have Karen Hubby from the Animal Coalition of Tampa. She'll be in studio to talk about Cinco de Givo.
Yeah, they had a tragedy last year. We'll get into it. The whole complex burnt down, and so they're trying to raise some money. So we'll have Karen come in and talk about it a little bit. It's a great cause.
Yes. And then Dr. Daniela Drake, an internal medicine specialist and columnist for the Daily Beast. She'll be on to discuss how nurse practitioners can now play doctor without having to go to medical school.
This one's going to get Doc fired up.
Yeah.
I can't wait for it.
Well, I don't know about you, but I find that very scary. Of course, we'll hear from her, and then we'll hear from you in What's New in American Medicine Today. But up first,
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
well, we have Kelly Ashling on the line, who has had surgeries from the Bonati Spine Institute, and she lives in Tallahassee, Florida. So thank you for joining us.
Thank you.
Well, why don't you start with your story? When I was speaking to you before, you said that you were very athletic, and why don't you tell us how you came to be in pain? Was it an accident, something degenerative in nature?
It originally started as a car accident, and I didn't realize that I had too much of a back problem to worry about. But over time, I was diagnosed with a degenerative disc issue, and my pain started back in 2006 and just kept going, and it really escalated by 2008. And it wasn't until May of 2013 that I actually had my procedure at Bonati, but I was in pain every day of my life, every minute that I was awake that entire time.
Wow. Well, before you jump ahead to when you came to Bonati, why don't you tell us the type of pain you were in? Was it something localized to one area? Did it radiate? What was that pain like for you, and how was it affecting your daily activities?
The pain was all different kinds. It came from anywhere from just muscle spasms, pain, a dull, achy pain, but I did have a lot of shooting pain into my head, into my arms, through me, in through the front of my chest. That was, one of the hardest ones. Sometimes it would make it difficult for me to breathe. It would be so severe.
Wow.
And so how did this affect your day-to-day life, Kelly?
Oh, from the second that I woke up, I couldn't even do basic things without having shooting pain. For example, sitting down at a meal at a table and reaching across the table to pick up a glass of water. Just that reaching motion would shoot pain into my chest.
Wow.
Opening a door, whether it was heavy or light, just that pulling motion or the pushing motion. Driving a car, whenever I looked behind me to check for traffic to pull out of a parking spot, that turning motion anything that had to do with pushing or pulling was just, I mean, so athletics were completely out because just basic household chores or living my life,
Right.
you know, picking up a laundry basket, doing dishes, everything in my life was affected by my pain.
And being in that kind of pain, I imagine it affects your attitude, your job, your family life. It probably affects every aspect of your life, no?
It definitely does. It made personal relationships difficult. It was a lot of lost time at work, a lot of sick days called in because it was difficult for me to just move around some days.
How did you manage the pain?
Oh, I went to see a lot of different practitioners, from neurologists, physical therapists, primary care physicians, pain management doctors, lots of different medications, but I didn't like being on the medications. I didn't like putting those things in my body on a daily basis, and I didn't like the way they made me feel and the side effects mostly. And sometimes I managed it, and sometimes it was unmanageable.
When you went to the doctors, what was their prognosis?
It seemed that no matter what doctor I went to or what their prognosis was, they always had temporary solutions. It was always take this medicine or undergo this temporary procedure, or whether it was an injection I had people try to prescribe me patches or electrodes and therapies, and I mean all the prescriptions and all of the solutions that I was given were all temporary, and none of them really truly got rid of all my pain.
Right.
And speaking of your pain, Kelly, where exactly was that pain? Was it on the right side or the left side?
I had problems on both sides, and the pain in my spine that I dealt with was in my thoracic area.
Okay.
Now, when you felt it on the left, did it feel like a heart attack? Did you think you might be having a heart attack?
It definitely, I was diagnosed with heart palpitations and elevated heart rate. It felt like something was sitting on my chest, made me difficult to breathe, and it was all from that shooting pain that came through my chest, yes.
So those doctors, they told you they couldn't do anything and they only prescribed meds, or did they say that any surgeries could help you?
Eventually, after years and years of basically trying everything that they threw at me, they told me that my best option for long-term pain relief was going to be to have traditional back surgery.
Got it. And at that point, what was kind of the straw that broke the camel's back, and how did you find the Bonati Spine Institute?
I think the straw that broke the camel's back was when all of my doctors pretty much gave up on me and said, "You either go under this knife, or there's nothing left for us to give you." I was not happy with any option that just involved more medication and more drugs and more invasive procedures.
And so what brought you to the Bonati Spine Institute, Kelly? How did you hear about us? Was it word of mouth?
I had seen a few advertisements about laser surgery. I had talked to some friends who had traditional back surgery. They had told me they had heard there was a laser spine institute in Florida. And so, really being in this day and age and being that I work in technology, I went straight to the internet and I did my research. And I didn't just follow the advertisements. I didn't just follow, links from a search engine. I actually went into actual medical journals.
Okay.
And I wanted to see what else was out there and what had been done. And looking at the statistics for the traditional back surgery, the results were just not anything that I was comfortable taking a risk on.
Right. So what was the deciding factor making you choose Dr. Bonati and the Bonati Spine Institute?
I think for me, the deciding factor was once I was done with my research, once I was finished talking with other patients of other types of surgeries, I had read a lot of the testimonials, a lot of the reviews. I had spoken to the staff to have my MRI review done at Bonati. I went down to visit. It is close for me geographically here in Florida, so that was a nice, easy decision to make there. But I think the biggest thing was seeing that Dr. Bonati had the patents on the instruments that he was using. There was just no doubt in my mind as to his skill set and how confident I was being on a table with him being my caregiver.
So you found Bonati, Kelly, through research on the internet. What was it like when you first made contact, you first came to the Institute and met with the crew at the Bonati Spine Institute?
It was fantastic. I honestly can say that, and I've been to a lot of doctors, that I've just never been treated so well. They just really kind of made me feel at home, kind of like family. There was a lot going on, and of course a lot of anxiety anytime you're going to go in there for a procedure and not really knowing what to expect. They explained everything. They reiterated everything for me. They always asked me if I had questions. They told me what was coming up next. they really made me and my family, who was there to support me for my procedure, just feel really comfortable about everything that was happening.
What was it like during the evaluation with Dr. Bonati? Did you feel like he really knew the root cause of your pain?
I can honestly say I remember very clearly my meeting with Dr. Bonati, because he walked into the room and he was able to look at some of the images and ask me a few questions. And the evaluation itself, which I believe was also from a nurse practitioner in combination with Dr. Bonati, they were so thorough. Out of all the years and all the doctors and all the visits and all of the times I've had to repeat what my pain was like, where it was, I'd never been asked so many specific and detailed questions and just really been paid attention to as closely and had so much, attentiveness in an appointment before. And so I just felt like they were just extremely thorough. And he walked in and he was able to, just from that information, put his hand on my back and say, "This is where your pain is coming from, isn't it?" And he was exactly right. He didn't fish around. He wasn't looking for any particular place in my spine. He really just laid his hand on my back, and he was exactly right.
What about when you were actually on the table? You were interactive with the doctor because of what we call conscious IV sedation, where you're in constant communication with the surgeon and the staffs during the procedure. Why don't you talk about that? What was that like?
That was a little weird, I'll be really honest. Laying face down and in that type of procedure, is a little scary, I think probably for anyone. But I remember the voices of multiple nurses, one at my feet, and one near my head talking to me, my anesthesiologist talking to me. I remember very distinctly Dr. Bonati's voice, asking me to do certain motions so we could kind of test things out and see how we were doing with some of the things that he was performing versus how my pain level was. And I'll never forget, one time during the procedure, he said, "Okay, go ahead and reach forward. Let's try and create your pain." And I reached forward, and for the first time in over 5 years, I didn't feel any pain, and I just started to cry.
Wow.
So that must have been quite a relief, knowing that you had tried multiple things and nothing had worked, and there you are on the table having surgery, interactive with Dr. Bonati, and for the first time in all those years, that pain relief. You mentioned starting to cry.
That was a relief for Kelly to scare the hell of me.
All of a sudden, your patient's in tears. Dr. Bonati's like, "What did I do?" And she's just grateful, right, Kelly?
No,
Yeah,
and
that
I
was
asked her
actually
what
right.
what
And
is
I think
wrong.
It was one of the nurses that said, "No, Dr. Bonati, it's okay. She's happy. Everything's all right." And thankfully reassured him that it was an amazing thing that he did nothing wrong.
Aw.
Excellent. Well, Kelly, how are you feeling today?
I'm doing really good. I've really been able to move on with my life and get back into being more active and being more athletic and doing the things I want to do with my life. I'm 22 weeks pregnant, so some of those activities are a little on hold right now.
Congratulations.
Yay.
All right.
So,
Didn't take you too long to play, huh?
I did. Yes, I really did.
I love it. All right, Kelly. Well, we're up against the break here. Keep us posted, especially about the baby that's on board, and
Yes.
hopefully continued pain-free living for you.
Yeah, mountain biking, rock climbing, all these different things. She
Baby
sent a bunch of
making.
photos.
Baby
So,
making. Yep.
congrats. We're so happy that you're living life in motion again and you've regained your strength.
Thanks for joining us, Kelly.
Thank you so much.
Thank you,
care.
Have a
Kelly.
great day. Good stuff.
You're listening to American Medicine Today. If you or someone you know is suffering with neck, back, or sciatic pain, reach out to the Bonati Spine Institute at Bonati.com. Coming up after the break, we're going to have Karen Hubby from the Animal Coalition of Tampa regarding Cinco de Mayo. Stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle. Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Brumell.
Thanks for staying tuned to American Medicine Today. I'm Kimberly Brumell, joined by our radio executive producer, Ethan Euchre.
I am here.
Well, in studio, we have a couple guests. We have Karen Hubby, executive director at ACT, the Animal Coalition of Tampa, and as well,
we have Megan
Megan
here.
Gross.
Yeah.
Mm-hmm. And they're here to talk about Give Day Tampa Bay, which is May 5th.
Yeah, and again, you know, obviously we are heard all up and down the Gulf Coast,
yes,
as well as in our new affiliates, Orlando. But this is a really big thing for the Tampa area, and you know, from what I understand, you guys had an arsonist burn down the Animal Coalition last year, correct, Karen?
Absolutely. One of the worst days ever in our history. We had 2001. We started Animal Coalition, and we had moved into a 10,000 square foot facility in 2012, where we could do everything that a vet's office did, but for a lot less, serving as many people as possible. Well, last April 19th, an arsonist came in and destroyed that for us, killed our 3 house cats, Jazz Boy and Mama, and since then we've been struggling. We've been in temporary facilities, and we're still existing, and we're still serving, but we've been struggling.
Yeah, I can imagine. And my wife does volunteering as well for a lot of animal causes, and she was furious when she found out about that, as well as a lot of people in the community. Do you guys know what the impetus was for that? Who did it? Why were the reasons
He's in jail,
behind it?
and he's only serving a 2-year sentence.
Only 2.
So he probably will be out before we find a new home.
Wow.
A permanent home.
Was it some vendetta against you all?
No,
or?
it was, to make a very long story short, it was a homeless gentleman. He came in, he had a very sick puppy. We took care of the puppy. He basically was collecting donations from the people in the lobby, very uncomfortable, left,
So
tied the puppy.
He was panhandling, basically.
He was panhandling.
I know you got to be careful what you say. I can say whatever I want. He was panhandling in your lobby.
He, someone given him some money. He went to leave, tied the dog with his belt to the bottom of the stairwell, and left the puppy there. One of our clients decided to give that puppy a better chance at life and took the puppy. He thought we had it, and it was a week of breaking windows and doors and that kind of thing, and then it ended up to, burning us.
Wow. That is unbelievable.
That's horrible.
And so the good thing is that you all knew who did it, so
Yes.
you could tell the cops who did it. They got him. He's in jail, he said.
That happened on a Saturday. He was arrested on a Monday.
Okay.
He didn't leave the area, surprisingly enough. He was still around the area that he was panhandling in. So.
Well, I mean, what do you got to lose at that point? So where did you all go from there? I know it's been a major rebuilding process.
Well, we moved back to the Lemon Street facility we were at before we went. It was sitting vacant. We were there up until in January of this year. So we were not doing everything that we could. We were doing spays and neuters 6 days a week. We're doing a shock clinic. We have a drop facility in the parking lot of the Gilchrist for wellness. So we're split. We lost 50% of our employees in limited services right now. And then we got a notice January 1st to vacate the Lemon Street facility. So we, with some pleading, we are staying there, but we are looking for a forever home.
Yeah. Okay.
And then that brings us to Cinco de Givo, that the party that's sponsored by, is it Ferg's Live Tampa across from the
Amalie Arena?
Amalie Arena.
Yeah, yes. We actually, Melissa with Irish 31 said, what can we do to help? And they have been so good to us.
That's a great place, too, by the way, over in Hyde Park. Yep.
Absolutely. All theirs.
Well,
and it's a whole big thing, too. And like I said at the beginning of this interview, is that, yes, it's Animal Coalition of Tampa is based out of Tampa, and we have affiliates all over Florida. But people can still make donations if you're an animal lover, you have a website, anything like that, because it's really this is one event that we're a part of as well, and we'll get to that in a second. But it's a whole big part of Give Day Tampa Bay, which is on May 5th. So for people listening on our affiliates that live in other markets, how can they get in touch and how can they help out? Megan, go ahead and grab that mic over here. Yeah, jump right in there.
Okay, so for Give Day Tampa Bay, since we're doing it in conjunction with Ferg's, Corona's a big sponsor, we've named it Cinco de Givo. And people can go to the website, www.cincodegivo.org, and click donate, and it'll direct them to the Give Day Tampa Bay pledge form. You can pledge now. It doesn't have to be on that day. And they'll send you an email reminding you that, you're pledged to donate to Animal Coalition on Give Day Tampa Bay.
Okay, that's excellent. So that is Tuesday, right? May 5th will be on a Tuesday.
Yes.
Sponsored by Ferg's Live. And there's also like a 24-hour online giving challenge, right?
Yeah, it's a crowdfunding platform. So, we're going to use the hashtag Cinco de Givo, make that go viral, to bring attention to not only the Animal Coalition, but Give Day Tampa Bay, which is 500 local nonprofits. So for 24 hours, they're trying to raise over $1 million.
And I'm just looking at some of the talking points here. You guys are saying that it's just as important to take into account your own medical expenses. It's important to consider the medical expenses that come along with having a pet before you adopt. I'm sure that's a big issue, right, Karen?
Yes. Well, that's what we're all about. It's what we started is a spay-neuter clinic because people couldn't afford that. So the shelters, the animals in the shelters that were euthanized for no reason because there's no room, we just have to, do something about that. So we made a big chunk of, we went from somewhere in the 30% to I think now in our shelters is 90% save rate right now in the Hillsborough County. So that's really important to us. If people can afford, our belief is if people can afford to take care of their animals, they will.
Yeah.
Very true.
Well, and there's so many people out there who don't. That it's the work that you all do, not only at Animal Coalition of Tampa, but at places like that, Humane Societies, things like that, all around the country. It's a very important service that you all do for the community and for the animals. One more time, what is the website if people do want to donate?
It's www.cincodegivo.org. So CINCODEGIVEO.org.
Perfect. All right. Well, Karen, Megan, thank you, both from the Animal Coalition of Tampa. Again, it's Give Day Tampa Bay. Coming up on Tuesday, if you're local, you can head over to the Cinco de Givo party, which is at Ferg's Live across from the Amalie Arena. I was laughing at you, Kimberly, because you clearly aren't a big hockey fan, or you would know about the Amalie Arena.
Wait, I've been to a few games. I have to admit, I'm not that overly familiar, so I apologize.
No, it's all good. So, again, cincodegivo.org. Good stuff. Thank you, ladies.
Thank you for having us.
And the Bonati Spine Institute thought it was a great place to give to and a cause to support. So therefore, I guess we became a superhero sponsor of the event. So we will see you on the 5th, and good luck in raising the money that you're looking to so that you can have a forever home.
Thank you.
To continue your good work. Well, you're listening to American Medicine Today. Stay tuned. You'll hear more. We'll catch you after the break.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today. I'm Kimberly Brumell, joined by our executive radio producer, Ethan Euchre.
Here as always.
Senior fellow, Jeff Wagstaff.
Present and accounted for.
And we have world-renowned orthopedic surgeon across from me.
Would you forget his name?
It was Alfred Bonati. I almost said Alfred Bonati, MD.
It's only his show. It's only his institute.
For him. What's your name again?
And you always receive a salary, you know?
Wow.
Just the guy who signs the check, but
I'm just the one who signs you check, you know?
Just the biggest rock star in this room. But
world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute.
Do it again, please.
We are covering a very important topic. Actually, on the line, we have Dr. Daniela Drake. She's an internal medicine specialist and columnist for the Daily Beast, as well as many other publications. And she's on to discuss how nurse practitioners can play doctor without going to medical school. This is something that makes me very upset, and I know bothers Dr. Bonati. Well, you wrote this article, Daniela, so welcome to the show.
Crazy talk.
Thank you. I'm surprised to hear from you because I think it's a 2-year-old article, but
It must be a topic that's coming up again.
That's actually the thing, is that George is one of our researchers at the Institute, and he came across your article because it was a very personal story that you had that dealt with this topic of nurse practitioners, I believe in 19 states now, are basically allowed to act as primary caregivers. Why don't you briefly, Dr. Drake, let us know real quick what your personal story was, because it's pretty harrowing.
Yes.
Well, that story was actually interesting. So personally, I was pregnant and I was preeclamptic, and I was going in toward the end. You go in for your every weekly visit, and I saw in her defense, a nurse practitioner at the bottom of the week, like the last visit on a Friday, and I had a lot of protein in my urine, which is sort of 4+, and according to OBGYNs that I've talked to in the past, that you're essentially visiting with the mother every week in order to detect preeclampsia, and that's what you're looking for. And so instead of her interpreting that as, let me go in and do a neurologic exam, she said that I had a urinary tract infection, which I didn't think that I had, and put me on Keflex and sent me home. My follow-up visit was supposed to be a week from then, but they didn't have a slot for me, so I came in on Monday, and the physician who saw me saw the urine and then examined me. It was, I had asterisk. I was like, as I say, I was flapping. And I was so neurologically impaired at that point, I wasn't even driving because I just felt so off that I didn't have any sense of what was going on. I was ill. And they ended up doing an emergency C-section on me.
Wow.
Unreal.
And so it's funny because some of the comments were there's some, nasty commenters, as you know. And some of the comments were like, that I was an idiot, and how come I didn't know that I had this? And I was like, I was really neurologically impaired when I look back.
And Dr. Drake, you're mentioning comments on your Daily Beast article about this. So basically what her story boils down to is, I was on a Friday, she saw a nurse practitioner who misdiagnosed her, essentially because she wanted to get out of there for the weekend. She took the whole weekend until she could be fit back in on Monday, where a doctor came in and said, that's absolutely not what you have. You've been misdiagnosed.
We have to get you right in.
And it could have cost her life.
Would her vital signs, and especially her blood pressure, not have told that nurse practitioner that there was something very wrong based on your conditions?
That might have been the case. Again, I was pretty neurologically impaired. I had stopped driving like about a month and a half before. I just didn't feel safe on the road. And I just thought, I'm just super pregnant. There's a lot of stuff that goes on with you neurologically, but none of it was getting pieced up, and I had been seeing nurse practitioner. That said, I opened the story with that because I've also had good experiences with nurse practitioners for very simple things in general. But it's a complicated topic. It's a complicated topic because I do work with some excellent nurse practitioners who I'm stunned at their savvy and their clinical acumen.
Well, Dr. Drake, let's because this is really a big topic for Dr. Bonati. Yes. I'd actually like to see both of your takes on this. I know you kind of do see eye to eye, both as MDs. Doc, your thoughts on this whole topic?
Well, I use nurse practitioners under my supervision. If a nurse practitioner will take any decision without me knowing in which direction it's going and why it's doing a diagnosis, I promise you I'll fire them. Now, my problem is this type of an easy acceptance of a professional that is not a doctor to play doctor, I think is wrong. And as you well know, not only the selection of the physician or the candidate to become a doctor is extremely, extremely hard, but at the same time, the performance and the years of experience is also very hard. And then you need to go to a specialty that makes the things even more harder and more difficult. And then suddenly, you're going to replace that brain and that training and that quality for somebody who has 3 years of training? I think it's absurd. And the acceptance of that, I think we're crazy. Anybody who can say that the nurse practitioner has a role without the doctor's supervision is sick or doesn't care for the society.
Dr. Drake?
Oh, interestingly enough, I had put, there was a comment in my article. My articles tend to be, can be read on many levels, generally speaking, but one of the things that I had put in there was, it was kind of a meta comment about what's happening in medicine in general. And what's happening in medicine in general is we've not allowed doctors to be doctors. We're forcing them to see too many patients, and we're being seen, and doctors are working by protocol. And so there's not a lot of thought being put into the visit. So I was basically saying, and I think I said somewhere in there, that at this point, an intelligent high school student with a smartphone could do the kind of medicine that we're forced to practice right now. And so it's within the context of the way that we're practicing medicine. You have diabetes. These are the 4 meds you go on, where an administrator can come down and tell you and demand to know why you didn't do things by protocol. Why not a nurse practitioner? Why not a high school student with a smartphone? I mean, why not? If we're practicing by cookbook, which is what we're kind of forced to do these days. So that whole context there, I have a real problem with the direction medicine's going. But it's my opinion, as long as we're practicing like that, nurse practitioners can do it pretty much as well as any doctor.
Well, I, with all the respect, I disagree. But at the same time, I know that the medicine is going in the wrong direction. I think we physicians are tolerating this behavior. I think we're allowing the insurance companies to crunch the payments to the physicians, so the physicians, they need to see an overwhelming amount of patients to be able to survive, and then they blame the bad quality of medical care to the physician, and then they start to bring individuals that are poorly trained to replace the physician. This is a socialistic behavior. That's why the socialistic countries work. What they do is they remove the name and the quality of the name of a doctor, and they ignore the training program and the endurance that individual did, and then suddenly they replace with individuals that don't have proper training. And the next thing that happens is they start to decrease the years of training of physicians, and then later on they place limits on the time that these physicians can exercise medicine. So really, in the future, if we continue, why to go to medical school? Go to learning just a nurse and become a doctor. I mean, that would be great.
They do it under the premise of being called a medical provider or a healthcare provider to desensitize the public into the assumption that a nurse practitioner is a doctor, and then between doctors and even DOs, or MDs and DOs.
With all due respect to Dr. Drake, I'm a little surprised to hear her say what she said, because if I were someone, and I'm a radio guy, I'm not.
I don't know anything.
I'm not in the medical profession,
Right.
and I want to say that up front. But as someone who goes to a doctor to look for that training and that advice when I have something, how do I know if I'm going to a doctor, a DO, a medical practitioner, or some kid who's practicing medicine off an internet program? The fact that Dr. Drake or other physicians are accepting of this, to me, isn't a problem in itself.
Exactly. I agree.
I feel Dr. Drake, and not that I'm trying to back you up either, but I feel like she's saying a lot of this almost being facetious, that, hey, why don't you just have a high school student do this?
I think she's doing it with a sense of sarcasm behind it.
Yeah, well, I understand. But, one of the problems that we need to have is we need to start to define and redefine who is a doctor. We need to redefine where these doctors train. And we need to redefine if this individual needs to be seeing 60 patients a day instead to be seeing, like in the past, 10 to 15 patients and being paid for those services. We cannot allow the insurance companies to govern medicine. We need to react against that, and we need to react against governmental ruling of trying to put individuals without training to treat my patients. I go sick with this. I think they need to have some medication for nausea with that.
Dr. Drake, we're just about up against the break. In closing, about 20 seconds, any parting remarks?
I think that the good doctor and I are in complete agreement. I mean, my sense is the direction we're going in is that the government has decided how we're supposed to practice medicine, and when you have that, then it doesn't really matter if you have training or not. And I think that's the direction that the corporations and the government want it to go. I don't think it's right, but I think what's happening is doctors like me who realize that it's the wrong direction are either just getting out or they have a very untraditional practice like I do, where I can actually take care of the patients without running protocols.
All right.
Well, thank you, Dr. Daniela Drake, internal medicine specialist and columnist for the Daily Beast. Thank you for sharing your take on how nurse practitioners can now play doctor without going to medical school.
Thanks, Dr. Drake.
Hey, thank you. Bye-bye.
Thank you, Dr. Drake.
And I know we're going to talk more about it in the next segment with Doc.
Absolutely.
He still looks fired up. So.
He is, and it's really a pity what Obamacare has done to this healthcare system. You're listening to American Medicine Today. Stay tuned, and you'll hear what's new in American Medicine Today coming up after the break.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thank you for listening to American Medicine Today. I'm Kimberly Brumell, joined by our radio executive producer, Ethan Euchre.
Always a pleasure to be here.
Senior fellow Jeff Wagstaff.
A continued pleasure.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Well, sir,
he's ready to knock it out.
You can.
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
All you, Doc.
Well, for a long time I'm saying constantly that there are certain terminologies that's being used in medicine to disprestige and drop down the importance of what means a doctor. And now we start to see exactly, after we're talking for months about this type of behavior.
Yes.
Well, insurance companies talk about the doctors like healthcare providers. The certain institutions, preferently the institutions that they are associated with pharmaceutical products, they talk about healthcare providers. The insurance companies talk about healthcare providers. And some of the dumb doctors also talk about healthcare providers. They don't understand that the healthcare provider is a terminology that comes from the socialistic behavior of the socialistic countries.
Right. Doc, why do you think some people, some of these, your fellow physicians, don't feel as vehemently about that terminology as you do? Have they been brainwashed by the system?
More than that. They are individuals, they never exposed to the system. For them, it doesn't mean anything.
Yeah.
But when they start to receive the backlash of that terminology, they're going to wake up, and it's going to be too late, because all these things are being planned since the 1960s. The destruction of America in healthcare is planned from the 1960s. Now, the problem
what do you mean by that for someone like myself?
They cheat the physicians initially when they said, well, the old people has no resources to pay the 20% that the insurance companies don't pay. So how about if we create a small little insurance that's going to be called Medicare?
This goes back to LBJ, right?
Exactly.
Yeah, okay.
And then these little insurance are going to be only providing the 20%. They were unfunded, and then suddenly what happened become the main insurance, because the insurance walk out from the 65 years old people, left the thing for the government, and now we have a situation that is a system that doesn't have the money, cannot do the service, and is doing a horrendous service to the people who pay for. Now.
But they paid their whole lives into that system.
Well,
so there should be money there.
There should be, but that was a whole Ponzi scheme in and of itself.
The politicians are keeping this money in their pocket, and they're using for other things. And one of the things they are using is try to defund Medicare, so they can start to institute the Obamacare, that is going to be an institution that is going to destroy Medicare. And then you're going to have two groups. One group is going to be the pediatric group that is not going to be attended because they don't produce money for the government, and the other group is the 65 and older. That also is a waste for the politicians on the left side, the Democrats. They do that. So what they do, they are going to destroy Medicare, and they are going to put the thing in Obamacare, and the next thing that happens, when you need to have a hip replacement, it's no money for you. When you need to have a cardiovascular surgery, it's no money for you. So the decision is going to be you're dead, or you die.
Here's what I don't get, Doc, because Democrats are known for, they're called bleeding heart liberals. They're supposed to care about people.
They don't. No. It's an elite group.
They care about getting
themselves.
A voter base.
Yeah.
That's what it is. It's enticing everyone, making them slaves to the system, so you ensure your voter base.
So it's all a front that, hey, we're going to help you, we care about you, but
Absolutely.
In reality, they just want your vote and they don't care about you.
The plan is to create a group that is going to be totally at the service of the elite, and the elite is going to manage the country. The problem is that is exactly where this country walk out in the revolution against England.
Right.
They didn't want this type of elite managing the country, and that's suddenly we're going to the same direction. Let me clarify the term that we got the initially I talked. Physicians, they need to resist the terminology of healthcare provider, because the idea is that the healthcare provider is going to be then Obama is not going to have enough physicians, because we'll not have enough physicians. They start to gather now groups of people that they are going to provide healthcare. Well, what is the next group? Before they did something like that between MDs and DOs. They add the DOs as the providers for healthcare. Well, now they got the nurses, and they are going to allow the nurses to do certain type of procedures or certain type of surgeries. Are you crazy? The anatomy, the physiology, the knowledge, the experience, and everything on a nurse is totally of post-care or care for specific things. But to try to practice medicine is a crime. But it's typical on the socialistic societies. They create very poor trained physicians, or in this case, nurses in the United States, that they are going to deliver the care, and the damage that is going to happen to the population is enormous.
Now, you've done medicine, you've traveled all over the world studying, lecturing, things like that. So you've seen some of these other
firsthand
methods of practice and socialization of medicine in practice. Is that basically what's happening in Europe and other places like that, England?
Well, in England, for example, the physicians, they have a period of time of practice. In Amsterdam, for example, in Holland, for example, a physician is 65 years old and they force you to retire. That is when the physician has the most experience.
Right.
And what does the physician really knows what is going on? But they are eliminating those individuals because they cannot pay.
Right.
And they're getting people that they are really with less salaries. They are replacing the expensive for the cheap.
And that's a look at what's new in medicine today with Alfred Bonati, MD.
Certainly a topic that's not going anywhere.
Exactly. I was going to say there's so much more to elaborate on. With that being said, sir, maybe next time.
Yep.
If you or someone you know is suffering with neck, back, or sciatic pain, reach out to the Bonati Spine Institute, 855-267-0482, or visit Bonati.com. Keep an eye out for us both Saturdays and Sundays nationally on Bloomberg. Check your local listings, and here locally, WFTS ABC 28, 7 p.m. on Saturdays. Also, you can check us out on our YouTube page and on WeBeam TV. And we'll catch you next week. Take care. You're watching American Medicine Today.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.